This is HealthCall Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the HealthCall Radio Hour, which is now made available to stations all across the country in national syndication. I'm sure I don't have to tell you at all about what a violent year 2023 has started out to be. Heck, I've kind of lost count of all the mass shooting incidents that have occurred, which is why my attention was drawn to a new report by the U.S. Secret Service National Threat Assessment Center. They just released a report called Mass Attacks in Public Spaces, taking a look at 173 incidents in a 4-year period. So I want to think about this a little bit differently. Let's move away from this as being a law enforcement issue, and I want to take a look at it as public health concern. So joining us today is Dr. Georges Benjamin. He is president of the American Public Health Association. He has focused over the years quite a bit on gun violence as a public health issue. So the right guy to talk to us about this. Doctor, thanks for joining us. Tell me, where does gun violence rank as a public health concern?
Listen, thanks for having me. It's a significant concern. Over 42,000 people die each and every year from gun-related events. And, more than twice that, over 100,000 people are injured from firearms. And I think the real tragedy here, what makes it a public health issue, is that it's preventable. A lot of it's preventable.
Oh, good. I want to get into how you think we can do that. One of the things I want to do is walk through just a few key points of this report and see what your thinking is on those. Here's one of them, for example. Most of the attackers had exhibited behavior that elicited concern in family, friends, acquaintances, and those individuals had feared for the safety of themselves or others. Now, I think we've all heard this. We know that in many cases we hear that the attackers set off red flags for people. What is the reddest of the red flags that we need to be paying attention to?
Well, I think that's the first one. That's the most important part of this, is that when we do the look back on almost every single one of these mass shootings, there was something there that had we identified it and acted, we might have been able to prevent it. And so, you have a family member that's in trouble. If you had a family member that had chest pain and you knew the signs and symptoms of a heart attack, you would work with them to get them to the hospital. And here we have someone who is having challenges. They have been more aggressive. They've done something that concerns you, and you have to deeper and try to figure out what's going on. And maybe they need some help. And as a family member or someone close to them, you should be able to help them.
So I've seen many cases, though, in which the family did reach out. Heck, there was a case in Indianapolis, a mass shooting at a FedEx depot where the 19-year-old young man had been in contact with police. They'd taken away his weapons. Their incident report even said that he intended to pull a gun on officers and try to commit suicide by cop. I mean, these cases happen over and over again. Where are we falling short? What's not out there in the system to help these families?
Somewhere along the way, we're not listening well enough, and we're often not connecting the dots. So simply being trouble may not be enough, but when someone says they're going to hurt someone, that should be a red flag. When someone has been involved in domestic violence case, that should be a red flag, and we should be following those cases along. And they may not require police intervention initially. They may require psychological intervention or social services intervention, but they need help. And we have not really crafted a societal system to wrap them around the things to provide them with that help. Now, look, there are evil people out there too. There are people who have simply lost it. And we have to identify those people as well.
So if I'm in that situation, if I have a family member and I've reached out police and they're saying, well, there's nothing we can really do, where in the public health system do I turn? What's my next step? And is the public health system the place to go?
I think the crisis mental health line can be helpful. If your city has one, and many of the cities do have one, I think that you can certainly be more persistent with police. Quite commonly, they don't want to violate that person's mental health and lock them up. But you often have to be persistent. Look, I know many people who have had heart attacks and nobody's listening, and their life has been saved because a family member was persistent. You just have to be more persistent. If you're pretty clear, you're worried. The other thing you can do, of course, is take the weapons out of the home,
Sure.
take those weapons away, get them out of the house. Um, and again, as there a lot of times these events accelerate over time. Today, the person's angry. Tomorrow, they're more distressed. They're more violent. They become withdrawn. So, understanding what the signs and symptoms are of a distressed family member or friend can be very important. You know, that 6-year-old that shot his teacher, in retrospect, we know that there were lots of red flags or lots of warning signs. Someone fell down on the job there. And looks like not only one person, but maybe several.
Yeah. And that does seem to happen time and again and again. What are you seeing across the country? Are there any examples you can point to where things have been done well, that communities have stepped up and taken action that was effective?
Well, we do see more and more where families have, they put in red flag laws and those
Hmm.
firearms are taken out of the home. So we know that that's a policy that works. We know that licensing firearms reduces the wrong people, getting those guns, criminal background checks. But we just have to be persistent. I think the one thing we have to stop doing is saying that because this event happened and a particular law would not have stopped it, we shouldn't do it. We learned a long time ago when our kids were dying from automobile crashes that we needed a multi-sectorial, comprehensive approach to making people safe in their cars, making people safe driving their cars, and making the community safe with cars and people in it. We need to do the same thing with firearms. We clearly have far too many firearms in the community, and we have firearms that aren't safe, and we have people that are not safe with their firearms, and we darn sure have many of the wrong people with firearms often when they shouldn't have them.
So, what's a policy you've advocated to make firearms safer?
We think that going back and making sure that we reconstruct these firearms, load indicators so that, you pick up a firearm, you take the clip out, and you think that the firearm is not loaded and there's still a round in the chamber. Wouldn't it be nice to know that that weapon is still loaded? The old James Bond gun. Theoretically, someone can't use your phone without your fingerprint or your code. They do make firearms that way. Now, these are all sophisticated technologies, but they do exist. Simply locking up the weapon in a gun box, separating the firearm from the bullets, because kids find those weapons. Again, licensing, closing the criminal background check loopholes will help keep these things away. I do think there is one class of firearms that we need to take another serious look at, and of course, that's weapons of war, assault weapons, and at least raising the age so that assault weapons, you can buy an assault weapon at the age of 18. You ought not be able to buy that until you're an adult, full adult at 21. Now, some people would argue, yeah, well, we allow people to go into the military at 17, 18 years of age. And my retort to that is, yes, under a well-regulated militia.
Mm-hmm.
We don't let kids buy them on their own. They should not be able to buy these weapons on their own.
Yeah, I know out there in the radio audience, somebody is screaming at the radio saying, so what's an assault weapon? Anything can be an assault weapon. Are you talking about high capacity magazines? Are you talking about weapons of a certain caliber?
Yeah,
those.
We have to be thoughtful about it, and it's true. You can take a weapon that you put on the list, you can adjust it, and it no longer sits on the list. And people will find a way to get around any rule that we put out there. But the issue here in public health is reducing the risk, reducing the number of firearms that are in people's hands, reducing the risk of firearms in the wrong hands in particular, and reducing the ability to kill many, many people in seconds. That's what we're trying to do.
So one of the another points in this report, this from the National Threat Assessment Center, is that a many of these shooters had some type of a triggering incident in which
Yeah.
they felt aggrieved. Something set them off. They felt that they were dismissed, discounted, or had some element of unfairness imposed upon them, often in the workplace. Is there anything that we can do to make workplaces safer? What does your organization look at in that regard?
Well, we have to do a better job of educating people in the workplace, managers, human resource people who are often in the position of dismissing people, and understand that when a person gets dismissed from a job or has felt they've been aggrieved at a job, that becomes a high risk incident. And we need to pay attention to those high risk incidents, particularly when we have those other events that have occurred where the person has shown some behavior in the workplace that concern their family members or concern their workers, when they've made threats. Again, connecting the dots will help us reduce this risk. And are we going to get rid of every single one of them? Of course not. But the goal is to dramatically reduce them. Look, other nations have done it, and we can do it here. There's nothing inherent in the American culture that makes us more violent or makes us more likely to do this thing, except the way we handle firearms, which is quite differently than other nations.
So what are my options if I'm an employee and I'm concerned about a coworker who I think has the potential for violence, and I feel as though my manager just isn't taking it seriously enough? I contact police and they say, well, has he done anything yet? And of course, the answer there is no. What choice? What can I do?
Now, the next course person, if your manager won't do it, you go to human resources and file a complaint, not just a verbal complaint, but put it in writing. And then go to your boss's boss. You just have to be persistent until you can get some reconciliation. Now, look, this is not an opportunity for you to get back at some worker that you're unhappy with. You have to be right about this. But we have to not be afraid to make those reports. And people in human resources have to become better trained at how to get help when they're at their wits' end with an employee.
Yeah, obviously they need to understand the law. What are their rights? How do they protect the rights of employees? All those things. Are we, so we're focusing here in this particular report on mass shootings, but what are we seeing with homicide in general? It feels as though the streets are getting more dangerous. Do the facts support that?
Depends on where you are. Actually, all in all, the individual violence in our communities, depending on the community, overall are down. But we have these high-level mass shootings that are up. And post-COVID, we are seeing an uptick in violence in many communities. We've seen an uptick in stress, broad stress in our communities. And that tragically, like many of the other health things, is because we really isolated from ourselves. We've become very stressful. People have lost their jobs. They've lost money. The stock market is down. People are under enormous stress. And so we do need to spend a lot more time giving people me time, trying to give them the opportunity to think about things and to give them the mental health support that they need.
Yeah, so glad you mentioned that. I'm struck by the fact that suicide is now a leading cause of death among senior citizens, men in particular, over age 65. Have you been taking a look at that, and what have we learned?
We have seniors, we have the veterans. And by the way, a lot of those people, if they have the access to a firearm, it becomes 100% pretty much. I mean, once you have a firearm and someone who's decided to try to shoot themselves, it's an impulse act. And if you can delay that act, you can save their life. A lot of people say, well, even if you take the gun away, they'll do it with something else. Well, when I was practicing in the emergency department, I can tell you that I was much more likely to be able to save someone's life if they had injected, depends on the poison, or tried to jump off a bridge or hurt themselves in some other way. I'm much more likely to be able to save their life. Firearms, much less likely to be able to do so.
Yeah, I saw a study that took a look at suicide attempts with firearms among senior citizens, people age 65, and they're pretty darn effective. They get the job done a high percentage of the time. It is really a sad scenario, isn't it?
Well, it's loneliness. And, I tell folks, reach out to your family members. If you have a neighbor that you know lives alone, reach out to them. Don't let them be alone. And we as a society have got to recognize that we are our brother's keeper. And unless we start wrapping our arms around our family members, our friends, getting out to know our neighbors, most of us get in our car in the morning, drive out of our suburbs or even out of our urban settings and go to work and then come back. We drive in the garage and we never really meet our neighbors. We need to do a better job of getting to know our neighbors and really building community back again. And the last, 2.5 years of COVID only made it worse.
Yeah, well, I have to agree with you on that. So Washington, as part of recent legislation, has included, I think, $100 million or more in community-related efforts to stop gun violence and violence in general. Can you look across the country and tell me what has worked? Are there some programs you can point to that are effective in that way?
There's a group called Cure Violence that out in California that does violence interruption. They're a very good group. And, there's a group in Boston that also does the same kind of thing. This is a group that engages in the community. They use prior either gang members or people who have been shot. They know the community. They reach out into the community. When someone's comes into the hospital and has been shot and survived, the likely scenario is that when they get well and go back out, somebody else comes in dead. And so they try to interrupt that violent activity by working with both the patient and, if they can, the people that put them in the hospital to try to interrupt that next phase of violence. These groups also enter into domestic violence situations. They engage with people who have been abused, male to male, female to female, male to female, doesn't matter, domestic violence situations, and they engage that to try to de-escalate that violence before a firearm is used. And then, of course, trying to reduce the incidence of firearms in those homes by getting people, again, to store their weapons properly, get the firearm out of the home if in any way possible. And look, there are a lot of guns in homes where people really don't want them there. They were left there by an old family member. A boyfriend left the gun at the home. Those guns can be turned in. Gun buyback programs, gun turn-in days, all those kinds of things that law enforcement does to reduce the number of firearms in our community.
I want to circle back to your ER experience there. When I'm discharged after being victim of a gunshot, is there any defined follow-up? Does anything happen on that social, psychological side, or are you just sent home and, here's some antibiotics and good luck?
Yeah, far too often you're just sent home. But when we do have those programs, those violent interrupter programs, they do counseling. They do engage people in the community. They try to work with those individuals, understanding how they got into that situation in the first place. A lot of times people are shot simply because they were in the wrong place at the wrong time. Yeah. They were a bystander that got hit. Right. And so trying to get them out of those situations can sometimes be difficult because they work in the hood or they work in a place where there's been workplace violence.
One of the remarkable things about our healthcare capabilities today is that so many gunshot victims survive. And you probably saw that in the ER. Do you have any idea what the cost to all of us is of gun violence? On an individual case, I've read that an ICU incident shooting is easily $250,000 or more.
Oh, well, think about it. Yeah, absolutely. It's the ambulance ride to the hospital. It's the ICU stay. It's the operation if you need it. It's the post rehab. Can be over $200,000, but collectively as a society, if you include all costs, it's over $500 billion annually that we spend. Over $500 billion annually that we spend. And, we got our members of Congress right now trying to figure out how to cut money and how to take money from needed programs. Well, I can tell you where they can save $500 billion with just a little bit of investment.
So walk that forward. Let's put you into that position. What is the first thing you would see if you were able to write the law, what is the first thing you think America could live with in the terms of trying to manage this outbreak of gun violence?
I would first address criminal background checks. I would then get to licensing. I would require licensing. I would require training before you use a firearm. Just like I went to high school. I had to do driver's ed before they put me behind the wheel of a car. I would do that. I would require storage and training about how to store your weapons safely. I would do a lot more educating with kids around firearms through creditable educational programs. We have some out there, but they're really designed to encourage kids to use guns. I would limit the marketing of firearms to kids. We have direct marketing to kids. I would not allow that to happen. I would certainly get weapons of war off our street. I would put red flag laws in every community, realizing that, look, I know taking someone's firearm away raises gun owners' blood pressure, but
Yeah.
there's a process you go through. It's a legal process that goes through, and the person, when they're okay and ready to get their firearm back, they can get the firearm back. It's usually temporary, and obviously, we need to deal with those what we call bad apple gun dealers. Because I know I grew up in Chicago, and I get tired of hearing about Chicago blamed for all the gun violence in Chicago. Well, there are no gun stores in Chicago. Those firearms come from outside the city. Even here in Washington, D.C., the firearms in D.C. and in Maryland, they generally come from outside of the state. So there are gun dealers that they know sell these guns. And so we need an alcohol, tobacco, and firearms division at the federal level that is resourced to really address that. And I think we need to let the Consumer Product Safety Commission work on, you asked me how do you make firearms safer. They address almost every other consumer product, including teddy bears. We ought to let them address the safety of firearms as well. Again, you didn't hear me say, with the exception of weapons of war, taking guns out of the hands of people who are law-abiding gun owners. I'm talking about making firearms safer, people safer with their firearms, and the community safer with firearms and people in it.
Yeah, that's a good place to leave it. I appreciate your time today. That is Dr. George Benjamin. He is the president of the American Public Health Association. Glad you were here.
Thank you very much.